You are watching the Wellness Hour, leader in medical news and information. I'm Randy Alvarez. Today's topic, we're talking about full mouth dentistry. With us, we have an expert on the topic, Dr. Perlitch. Dr. Perlitch, welcome to the program.
Thank you very much.
Now, before we get into today's topic, for people that don't know you, tell me a little bit about your practice. I mean, who's a typical patient and what are the different procedures that you do?
Well, currently I have a family practice, which has been treating many patients from the early ages of 1 all the way up to, my oldest patient's 100 years old.
Is that
April.
right? 100. Okay.
100. But my main focus right now is on patients that have many dental problems and have had problems for a long time and are experiencing chronic pain almost on a daily basis, and are avoiding the dentist because of the pain and the fear that they feel they're going to experience. These patients are right in feeling that way because their treatment plans will be very complex, and it will take several visits for them to become educated in knowing what we can do for them.
Okay.
We generally start with a patient who doesn't even understand what diseases are happening in their mouth.
Okay.
So we spend a lot of time talking to them about how they can make their whole mouth healthy, their whole body healthy, actually.
Okay, all right.
So that's where we really start. A lot of patients have chronic physical conditions, whether it be diabetes, high blood pressure, or they are taking some antidepressants which have caused problems in their mouths.
Okay.
And they know about it, whether it be just the sensitivity of hot and cold or loose teeth or bleeding gums. And they'll come to see me, and we spend quite a bit of time collecting information.
Okay.
Probably 2 visits just in getting to know them. And then we sit them down and start the educational process right away on what we can do for them.
Let's back up for a moment. And at the top of the show, I said you're an expert. And I'm reading your bio, a lot of training. Tell me a little bit about your background and training. I guess you've been a dentist in your head since you were about 16 years old.
I have been a dentist in my head since I was 16. And I worked as a dental assistant. Then I went to dental hygiene school. I taught dental hygiene. I went back for a master's in dental hygiene, and then decided to go on to dental school.
Is that right? Is that rare? Is that common? The dental hygienist becomes the dentist?
I think it's more common than you might think.
And does it help you to be a better dentist in your view?
Absolutely.
Why?
Absolutely, because we have seen the work as a dental hygienist, and we're scaling teeth and we're moving from tooth to tooth. We see the disease process. We see it around the dental work that's been done. We see it around dental work that has not been done that the patient needs. So if you've been a hygienist for a number of years, you'll have seen the progression of these disease processes.
Okay, what do you like most about what you do? I always like to ask the doctors that come on this show.
I love to educate that patient and bring them up to a total health so that they know that they can have a smile that can last a lifetime.
Okay.
If you've had dental problems for 20 years, you're pretty convinced that each time you go in, you're going to have another problem. But it doesn't have to be that way. Currently, dentistry is a reactive program. What
do you mean by that?
Where a patient comes in, we see, oh, there's decay, let's fix it. Or, oh, there's a periodontal pocket, there's bleeding, let's fix it. Whereas if we can start by identifying what the patient has tendencies towards, whether it be that we take a pH sample and see that their acid level is very low, which leads to the teeth losing the minerals, and alter that, bring their pH up through some total health program, then we can prevent that decay from happening in the first place. And it's not always not to eat dessert. It has a lot to do with your body chemistry, and we can customize that.
Okay. Now this full mouth, and I guess behind the scenes, full mouth reconstruction. Who's a candidate for that, and what do you want people to know about that?
Well, the full mouth reconstruction is where we look at the patient and at any age, and we ask ourselves the teeth, where they are positioned and the condition that they're in now, are going to last for 100 years? That's my question.
Okay.
And if not, then we look at the reasons why. If we see wear, even if it's slight wear, if we see overlap, if we see teeth that are tilted towards the tongue to where the bite might be a little bit off, then we want to fix that. We want to align the teeth in the most comfortable position. We want to treat the teeth on the surface so that they're not only hard and resistant to dental disease, but also look good.
Okay.
Teeth are rarely born ugly. They might be stained, but the ugly teeth tend to get treated. It's the ones that come in that are just slightly twisted, that maybe perhaps a tooth was bumped when they were a child, and that tooth is non-vital. They might have just that one tooth in the front that's a little dark, and they live with that. But it can be fixed.
Okay. Now you're a general dentist, but you work with a team. I look at your website, and I love this picture, by the way. It's a team of guys all around you.
It's a team of guys. And that's by accident.
Okay.
But what I found, being in practice being in a dental office since 1974, is that one person, I think, can try to do it all, but a more predictable result in my practice comes from gathering a team of experts, gathering a team of specialists, the oral surgeon, the orthodontist, the periodontist, the endodontist. And when the patient comes to see me, we will do the diagnosis, which will take several hours. But then I carry your information from specialist to specialist, and we sit and we talk. And I choose the specialist that I think you're going to like.
Okay.
One of the issues of going to a large practice is you might love that periodontist, but the endodontist that's in that office you might not like so much.
Okay.
And so you may feel obligated to stay there. For us, I never, ever let an oral surgeon cut you unless you love them. I feel that way about any kind of medical procedures. You have to love that person if you're going under.
Why?
Because...
I mean, do people really love their dentist?
Absolutely.
Okay.
If you don't love your dentist, go find another one.
Okay. All right.
If you don't love your dentist, your level of compliance is always going to be leaning a little bit more on the skeptical side.
Okay.
So you want to make the right match.
Okay.
And I feel like I am the matchmaker for the specialists. The specialists are out there, but many times they're very far removed. And for you to get to sit with that specialist may take a period of appointments that can be redundant for each specialist that you go to.
Okay.
I'm the one that will advocate for your treatment. I'll visit these specialists. They'll come to me.
Is it more expensive to do this type of dentistry with
you know, you might
all these people
suspect
involved?
That it is. But if I have a relationship with that specialist and the specialist knows that you're going to come in prepared, you're going to become educated, all of the treatment preliminaries will be completed at that time, or before you come in, then they are willing to negotiate that fee because they don't have to do that. Those additional upfront expenses aren't there anymore.
Okay. So what's the advantage of going to somebody like you then? Your mouth's falling apart, in bad shape. What's the main benefit of this team?
Well, the number one advantage is that the treatment plan will be customized to you in a very personal way, whether it be your financial, whether it be your own value system,
okay,
or other circumstances, maybe around your health, so that you will not have to explain these to all of the specialists. These will all be taken into consideration when I make the treatment plan. So I will draw out all of the personal fears and the concerns and considerations that you might have towards these comprehensive plans, the things that have prevented you from having this done in the first place. You might have gone to an oral surgeon to have a tooth extracted because you were in unbearable pain.
Okay.
But then that may have been the last time you ever saw that specialist. You're done with him. For me, what I'll do is I'll speak to you and we'll customize this plan. We'll make it very personal. And then I will present that and gather my team. I will seek out those professionals that I think are compatible with you, those specialists that will be compatible with you.
Okay.
Sit down with them, go over your plan. We negotiate finances actually to the letter. My lab is one of the first places that I go with the treatment plan, because the bottom line is that your restorative work has to be realistic and sustainable, meaning that you have to be able to clean it, and we want it to last for years. When I see that a standard of care is 5 years for a crown, and we're replacing these crowns 3 or 4 times in a lifetime, the trauma that the tooth takes is inevitably going to lead to either some nerve therapy or even the tooth loss. And that's why we go towards our implants, because of the predictability.
Is it common, by the way, that people are a mess? I mean, are there people walking around San Diego that their mouths are a disaster? I mean, how common is it?
It's hard to determine because those patients haven't come in for us to statistically be able to evaluate. But we do know on a worldwide level that the United States is number 2 behind the UK in dental disease. And that is a fascinating statistic when we have all this technology here. I do think that I
mean, do people come in and say, Doc, I bet you've never seen anything this bad in your life?
Of course they do.
How often do you hear that?
I hear that almost every day.
Is that right? And people don't like going to the dentist.
No,
Do they
don't.
say that to you?
They do. Or we'll ask why, and they'll give us some experiences that they've had, or the level of shame that they might feel because of the neglect that they've given their mouths. Sometimes that neglect isn't caused by them not caring, it's because they had other priorities. And they could never manage how they could pay for such an expensive treatment plan. And part of our job is to show them what creative financing can do.
Okay, so these people out there that have their mouths are in a disaster, I guess they don't know if they're going to lose all their teeth, if they have to go to dentures or dental implants. And we're just about out of time. What's your message to this crowd of people that their mouths are in bad shape? Maybe they haven't been to the dentist in 5 years, 10 years, 15 years. What do you say to them?
I say to seek out someone who's going to sit down with you, look in your mouth, talk to you, educate you on what can be done, and know that no one is going to have you become worse off than what you are now.
Okay, okay. And so with you, your website, they can visit your website, take a look at, and you brought a photo right here. And I can't, I'll try to show this photo. What am I looking at here? What is going on in this photo?
Well, this is a typical all-on-4 case that we have.
Okay.
This is the before. The gentleman had been living with this kind of periodontal condition for 20, 30 years. And this is what we've done for him. And this was done all in one visit.
Looks terrible. After.
I know. I have one of them.
I mean, the teeth are straight, but I mean, I'm just saying, to me.
These are 2 dentures.
Okay.
And they're permanently screwed into the bone.
All right. So
that he walked out with teeth that were weapons.
Okay, okay.
And he's doing quite well.
So this all-on-4, and we are out of time, but this all-on-4, what are the main benefits as a recap? I don't even know what all-on-4 is. We haven't established what that is yet.
Right.
But what are the benefits of this?
The benefits of all-on-4 is it's an affordable treatment for patients who really are crippled and will be losing all of their teeth. It's certainly far beyond dentures, and right now our studies show that it lasts for 20 years.
Okay, good. Well, I want to thank you for coming on the show. Final message. Is there anything that driving over to our studio, you say, I want to say this, is there anything you'd like to add to this conversation? Any message that you want to bring up about this full mouth kind of dentistry?
I think for full mouth dentistry, you look at the long run, and that it may be expensive on the up front, but the length of time that dentistry is going to last will easily pay for it. So.
Okay, good. I want to thank you for coming to the show. Great information. They can visit your website. We'll put your number and the web at the bottom of this screen.
Okay.
So thanks a lot.
Thank you very much.
You've been watching The Wellness Hour, leader in medical news and information. I'm Randy Alvarez. We'll be right back.